like to call up now our MythBusters to come sit at the table here. Okay, this is kind of the meat of the program here, and we are lucky to have with us some folks from different constituencies, different areas of expertise to help address some of the myths that we all were hearing during August. We're really going to try to figure out here who's telling the truth about health reform, who's lying, and who's just confused. So now let's go on to the myth busting. I guess before I ask the questions, I want to just take a moment to say who these folks are so that you won't be hearing from people that you have not been introduced to. So starting with the gentleman next to me, this is Freddie Castilblanco. Did I say it correctly? Yes? He's the owner of Terraza 7 Train Cafe in Queens. He is a small business owner and a leader in Small Business United for Healthcare, which is a project of Make the Road New York. So we're delighted to have a small business owner with us. Next to him is Dr. Oni Blackstock. She is from Physicians, the National Physicians Alliance. She practices at Harlem Hospital, where she treats people with HIV/AIDS, and I seem to recall that she's a graduate of Harvard Medical School. Is that right? Okay, thank you. We're delighted to have you. Next to her is a longtime friend of mine, Alice Berger, who is with Planned Parenthood of New York City. She works on healthcare restructuring and a variety of other important things for Planned Parenthood, and knows a lot not only about the health system but also about reproductive issues. Then we have Tim Foley from New York City for Change, who I've just gotten to know recently. He works with, I believe, Committee for Interns and Residents. Is that right? It's the union that represents interns and residents who work in hospitals in the city. And last but certainly not least is Joan Davis from the Great Panthers, who is an outspoken advocate for older women and the needs of older women. So let's give a nice welcome to our panel. All right, I'm going to toss the first myth out here. And this one goes to Tim Foley. Tim, I've heard that health reform is going to be nothing but a government takeover of the health system and even socialized medicine. Is this true?
Well, whenever I've gotten that question in the past, I always think of my grandfather, because he would periodically turn to my grandmother and say, "We're going to have a fight now, pick a topic." No matter what healthcare proposal was going to be on the table, the people against it were going to say it was a government takeover of your healthcare, because this is what's happened literally at every other time in our history. But what do they mean by that? Do they mean that it will literally be a takeover? Doctors will become government employees, hospitals will be operated by the federal government similar to the way that they are in Great Britain? No. There's no plan on the table that would do anything remotely like that. Does that mean that the government will be solely responsible for paying for your health care? That will in fact become a single payer, and that private insurance will either have to just become an administrative function of a federal payer or cease to exist? Unfortunately, no. I think many folks in this room would enthusiastically embrace that if that's the direction the President, the leadership in Congress decided to go, but they have not. What they are proposing is healthcare reform that would build on what works. And like it or not, for about 160 million Americans, what quote-unquote works for them is insurance, primarily through private, either for-profit or not-for-profits, that they get through their employer. So you don't have to take my word for it that that private insurance won't fall off a cliff into the sea if reform passes. Luckily, we have experts in economics and accounting who can do that for me. Just this afternoon, the nonpartisan Congressional Budget Office posted an answer to this question on their blog. Yes, the CBO has a blog, in which they received a question from Republican Senator Mike Enzi saying, in effect, would private insurance, especially through your employer, cease to exist under healthcare reform? And the answer is CBO and JCT, the Joint Commission on Taxation, estimated that the version of healthcare reform that was introduced in the Senate on July 1 would not have a major effect on the number of people obtaining coverage through an employer. That's fine for those who get coverage through their employer, but we also know there's this thing called an exchange, a transparent marketplace, where individuals and small businesses who don't have comprehensive health benefits would be able to purchase it. That's going to be the government takeover of health insurance, right? Well, actually, no. Most of the plans that would be in the exchange would themselves be private insurance. You'd have a wider range of plans going from Aetna to WellPoint with a minimum standard of benefits and with a subsidy or a tax credit to make it affordable, but playing by certain rules. Now, when they're talking about a government takeover of healthcare, usually they're talking about the public health insurance option. That is one option alongside Aetna and WellPoint and all the other bozos in the exchange who are offering you health insurance plans. It is only open to individuals and small businesses who don't have coverage already. The Congressional Budget Office took a look at it and said probably about 10 million people would be in there. If 10 million people constitutes a government takeover of anything in a country of 300 million people, I will be heartily surprised. The Lewin Group is another group. If you don't like the CBO's numbers, there's the Lewin Group. They also study and project on healthcare costs and spending and so on and so forth. They suggest that probably within 10 years you would have 32 million people in a public health insurance option. What they also mention, both the CBO and the Lewin Group, is because you have this exchange, most of the people in the exchange will choose a private insurance plan of one sort or another. We have 160 million people in private insurance today. The estimate is that after reform, there will be 180 million people in private insurance. Better private insurance, better regulated with more consumer protections, and that's made affordable, but private nonetheless. If a government takeover of healthcare and putting private insurance out of business means adding 20 million people to it, then perhaps they're suggesting that we're going to kill them with kindness.
Doesn't sound like a government takeover to me, Tim. Speaking of blogs, Tim has an excellent blog. Want to tell us what it is?
Yes, it's healthcare.change.org. Change.org is not the same as change.gov. We existed first, damn it. And it's a progressive website and social media website. I write twice a day on the topic of universal health care.
Okay, let's give a hand to our first Mythbuster.